So we had really just started talking about schizophrenia. I think I went through the symptomology, so the positive and the negative symptoms, as well as some demographics. And now we'll move on to some of the mysteries of schizophrenia. Your author does list many mysteries, and I think I have all or most of them listed here. You can pause this and you can read this. I'm not going to go through them all. Part of my point in having the many mysteries is it is a pretty mysterious mental disorder, and these don't fit neatly into any box, and they don't really inform us as to what's going on with people who have schizophrenia or why they have schizophrenia, or what the relationship is between these mysteries and schizophrenia. But so it is less common in people with type 1 diabetes, more common in people with type 2 diabetes, so that diabetes that comes later in life and is more environmentally driven, most likely. Women who have a schizophrenic breakdown during pregnancy usually give birth to girls. Those who have a breakdown shortly after birth usually give birth to boys. Again, what all of that means is I'm not really sure. We don't know. They are producing a particular chemical, which gives them a characteristic body odor, and they have a decreased ability to smell that chemical themselves. And as I've mentioned before, when we talked about eye movements, they have difficulty with pursuit eye movements. Instead of making a pursuit eye movement, they are not completely focusing on that, and they are making short saccadic movements in order to keep up with something that they are pursuing in time, in space. And so do many of their undiagnosed family members. I think I mentioned this before as well, so I want to get on an eye tracker and see. I think I had this and their undiagnosed family members from a previous edition of CALET. And then I read somewhere else it's more like 75% of undiagnosed family members. And again, what this is unclear, and whether the family members are learning this from a family member who has schizophrenia, or are this is something that is genetic, it's unclear. Schizophrenia is another one of those mental disorders where we cannot point to a single gene. So we talked about Huntington's disease and how we can point to chromosome 4 and exactly where we're going to see the mutations of what causes that. But with schizophrenia, I think I'm going to talk about this again, so I'm not going to talk about it too much here, but it appears to be 100 or hundreds of genes involved, where we might have some mutation or a microdeletion, some small absence in those genes. It makes it much more likely for people to have schizophrenia in particular genes, but we don't know what they are. There's no gene we're pointing to, but it does appear to have a genetic basis. Monozygotic twins have a higher concordance rate than dizygotic twins. And we can see this is a nice kind of probabilities of developing schizophrenia based on how many relations you have and who those relations are. So the children of 2 schizophrenic parents are pretty likely. If we move to and dizygotic twins are more likely than other siblings, and we will talk about the importance of environment, and particularly for schizophrenia, it's very clear that prenatal environment is really important. Children of schizophrenic mothers, even when they're adopted by non-schizophrenic mothers, are more likely to be schizophrenic. And we can see, again, in the general population, it's estimated at about 1%. So another kind of listing of aspects of genetics, because again, it's a pretty complicated disorder of what's going on and why we're seeing it. Adopted children are more likely to become schizophrenic if their biological relatives have schizophrenia. So if I'm adopted and I have schizophrenia, 12.5% of my biological family, that's in this study, that's the percentage they found, are going to have schizophrenia, and none of my adopting family. If I'm remembering correctly, this was a large study conducted in Norway or Sweden or somewhere like that. So really not, this makes it look like it's really not environmental as we're doing those concordance rates, but it's really not that straightforward. We really are inheriting a genetic predisposition, and there appears to almost need to be some dysfunction in the family for us to see that predisposition come to fruition. So there's an interaction between the child having a schizophrenic mother and the amount of dysfunction in the adopting family when they've looked at those adoption studies. If we look at genetics or the specific genes, again, there are I think he estimates 100, but it used to be said dozens. Now that says 100, hundreds. We don't know how many genes are involved with schizophrenia, and there is not a gene that they point to and say this is the one. But that being said, and you might notice this or know this for autism as well, that they have the same kind of, we don't know. We think there might be hundreds of genes, maybe over 100 genes, and while we're not pointing to any, we do point to one or two in autism. Well, the one that we point to as what appears to be the strongest gene that we can see is DISC1, as they call it, which stands for disrupted in schizophrenia 1. And this gene controls the production of dendritic spines and generation of new neurons in the hippocampus. Other genes that we see as linked to schizophrenia are important for brain development as well, and glutamate specifically, and then connections between the hippocampus and the prefrontal cortex. Again, it's only in about 1% of the population, and if we look at this, people with schizophrenia tend to die younger and have fewer children on average than, quote, normal people. And their siblings are not compensating. Their siblings are not having more children in order to compensate for people with who inherit and then show the disorder of schizophrenia, dying young and having fewer children, which means that we would expect to see this eventually die out of the population as we see how natural selection works. But that's why they're saying, that's why they started looking towards more and more possible genes and looking for other explanations. And so other explanations include new gene mutations as an explanation, as well as I have here microdeletions and microduplications, but my understanding and from what I've heard from people, they've noticed those microdeletions where there's just a bit of the gene that is just missing. Okay, so a nucleotide that's just missing. So mutations in a single gene are pretty rare, but if we decide that there are hundreds of genes, this is going to be not so rare. We all have a likelihood of some slight mutation or a microdeletion in our genetics, and it just doesn't change any really coding of proteins. But if we're looking at a particular set of genetics, so the hundreds of genes potentially involved in schizophrenia, then that's not so rare, and it might give us the genetic predisposition. So researchers found microdeletions and microduplications in 5% of a control group, 15% of schizophrenics, and then 20% of schizophrenics with onset before age 18. So we do see some relationship, but again, just some percentages to consider. I'm going to go through several hypotheses about what is going on with people who have schizophrenia. And I'm going to start with this really overarching neurodevelopmental hypothesis. And the idea is that schizophrenia begins with abnormalities that we see in the prenatal or neonatal development of the nervous system. And this is leaving that developing brain vulnerable to disturbances, to dysfunction, to other things that are happening later in life. One thing we see is that there are several kinds of prenatal or neonatal difficulties. I'm going to roll through a few of them, but certainly not all of them, but some examples that are then linked to a higher likelihood of later having schizophrenia. We do see that people with schizophrenia have minor brain abnormalities that apparently originate early in life, and because of the way So what's happening during puberty, it makes sense. It is plausible that those abnormalities of early development, we might not see that symptomology early in life, but that they could impair behavior into adulthood. So this neurodevelopmental hypothesis is a pretty good hypothesis as far as what's raising the risk of schizophrenia. And then your author goes through some intermediate risk factors and then some low risk factors, and he does not provide, there are no really high risk factors. There aren't a lot of things that we can point to say, if this happens, you are much more likely to have a baby who is schizophrenic. They're just somewhat elevating the risk. And some of those include the poor nutrition of the mother while pregnant, whether that is, there are certain nutrients that specifically make it more likely, and so any kind of substance abuse and sleep problems and stress problems, low birth weight of the baby, complications during pregnancy, complications of the birth. If the mother was exposed to extreme stress early in the pregnancy, this raises the chances, so especially some kind of stress due to loss. We see that if a mother is Rh negative and her baby is Rh positive, that that can trigger an immunological rejection by the mother, and the antibodies can cross the placenta and damage the baby's brain. This is stronger later in pregnancies. So if I've already had a baby who's Rh positive, then the next few times I've already started to develop those antibodies, and that becomes more likely than with boys born second and third, and girls as well, but it's also, this rejection response is more intense with boys than with girls. We also see that relationship of the Rh negative mother and the Rh positive baby. Those babies have a higher incidence of hearing defects, mental retardation, and then about 2 times the likelihood of becoming schizophrenic. We see a season of birth effect where winter babies are have a 5 to 8% chance of schizophrenia, and remember it's 1% in the population, so this is occurring much more often with winter babies. It appears that it was during a certain point in pregnancy where their mothers were more likely to be exposed to influenza and other viral epidemics. One very large study that examined this took place in England, Scotland, and Denmark, where they looked at tens of thousands of people, and they looked at hospitals had taken blood from pregnant women and stored that blood for decades. And then they went back and looked what was the incidence of schizophrenia and what was the likelihood of having some kind of influenza or other virus. And it looks like they found increased schizophrenia born in people who were just 2 to 3 months after major influenza epidemics, and they found increased influenza virus among mothers whose children eventually developed schizophrenia. We also see rates of schizophrenia as being increased if the mother has had during pregnancy rubella, herpes, or other infections. So viral infections in the mother can do a number of things here. One is to increase the cytokines in the mother that can impair the brain development of the fetus. And second is to cause a fever that can also damage fetal brain development. Another infection during childhood can also increase the risk of schizophrenia, and this is the infection of Toxoplasma gondii. Callett talked about this earlier in the emotion chapter, and I skipped it, but we're going to come back to it briefly here, where these parasites can live inside cats, and cats aren't bothered by them. The cats will then poop them out, and so they'll be in the cat poop. And other animals might burrow or nest or eat some of that cat poop, get the parasite into them, and it damages their amygdala, which then makes them, so they're not afraid of cats and are more likely to be killed and eaten by the cat, and thus the cat gets the parasite back into it. And the parasite has a way to live. These are parasites that are also potentially dangerous to people, and especially pregnant mothers should stay away from cat poop, or at least, if you're changing a litter box, do it with gloves. And immunocompromised people, and then during early childhood as well, it can increase the risk. Finally, another aspect of environment that he talks about is head injuries in early childhood, and what's happening there is less clear, but having a head injury in early childhood is correlated with schizophrenia. Whether the schizophrenia is causing a more likelihood to have a head injury, or whether a head injury is making the brain more vulnerable to schizophrenia or causing some abnormal brain development is unclear. But there are, so I'm going to talk about the symptoms, or we talked about the symptoms, and I am going to talk about them as something we really start to see during puberty. This is going to become more and more clear the more I talk about schizophrenia, and after, so into after puberty. But there are studies that suggest that even during childhood, it was somewhat clear that the child was different, and they see some, if they've gone back to look at, to watch people after they've developed schizophrenia, and now that we have the ability, or as soon as we really got the ability to go back and look at videotapes and recordings of people in their youth, they were noticing that they were just not having the same kinds of emotional responses. And so there are some differences in children who have schizophrenia. They just don't have the symptomology that we see as we get older. But what's happening with those head injuries? It's unclear. It's one of those correlations that's just we don't know if it's the A affecting B, B affecting A, or some third variable involved. People with schizophrenia tend to show some mild brain abnormalities that they vary from person to person and exactly how different the brain is than quote normal. But we tend to see less than average gray matter. That's particularly in the hippocampus, the amygdala, and the thalamus. And we see reduced white matter as well, so some of the communication tracts. We also see larger than average ventricles. And so this picture is showing, I'm pretty sure this is two twins. Yes, two monozygotic twins, where the one on the left has schizophrenia and the one on the right does not. And it's pointing to the ventricles. And if you remember, that's where we had the cerebrospinal fluid. We also saw these as getting slightly larger in people with Huntington's disease as they're losing the neurons around those ventricles, but this is a clear indication of brain loss. We tend to see the strongest deficits in the left temporal and frontal areas of the cortex. They also tend to have a smaller thalamus, and the dorsolateral prefrontal cortex is not only smaller, but it has weaker than average connections between the dorsolateral prefrontal cortex and other areas. We actually have talked now about the dorsolateral prefrontal cortex a number of times because we did the Stroop task, and I mentioned it there that it's helping us to inhibit that wrong response. And we can go back to the task that they were creating disorganized speech in people and see that inhibition of an unwanted response, it takes effort, and we're seeing less activity in that area for people who are schizophrenic, as well as weaker connectivity. And so what it looks like they're doing in a lot of these tasks is to in research is to have different connectivity or different communication in different areas, trying to compensate basically for that weakness in the dorsolateral prefrontal cortex. But what all of that means is that there are deficits in memory and attention, which now I have mentioned a few times. I also got one of these pictures from, what's her name, Laura Freeberg, and the Behavioral Neuroscience book, as I think it's a very telling picture. And the yellow areas in this picture are showing where there's decreased brain volume in many studies. And then as it gets darker and darker red, there's decreased brain volume in schizophrenics compared to normal people in fewer and fewer studies. But what we see is when we go through that, if you would go back to the development of the brain during adolescence, and we saw that synaptic pruning that occurred. So we see this exuberance and proliferation of neurons when we are early in adolescence, and that synaptic pruning, where we are now making the brain more efficient by the time we are towards the end of our really emerging adulthood, so about the age of 25 years old, that brain loss at that point, when we see brain loss in, quote, normal people, because of healthy synaptic pruning, we see a great deal more brain loss in people with schizophrenia. So in 1971 and 1976, Patricia Goldman published a couple of studies looking at monkeys where she damaged the dorsolateral prefrontal cortex of the infant monkey, looked 1 year later at several tasks, and the age 1 monkeys, whether they had the damage or did not have the damage, they did about as well on the task. But then by the time they were 2 years old, there was now a clear effect of the lesion, of the damage that was done when they were infants, and they performed much worse than the undamaged monkeys. And what this suggests is, to a great extent, that when the monkeys were at 1 year old, neither one was very good at the task, as really the dorsolateral prefrontal cortex is those areas of the frontal lobes are some of the last areas for us to develop. And again, we're doing this later in our lives, and so we're not seeing as much of the influence of that when it's not yet developed anyway. By the time the monkeys are 2 years old, they've developed, and they're at the point when they can do these more memory attention tasks. And so now we see a clear effect of the lesion or damage.